Nobles, and I serve as chair of the Licensed Psychology Advisory Committee of the Kansas Behavioral Sciences Regulatory Board. And I ask members of the committee to respond to a roll call to signify their presence at this open meeting that is being conducted remotely by conference call and other electronic medium. Linda Heitzman Powell.
Present. Can you hear me?
Yes, I heard you. Thank you.
Okay.
David Stevens. Abby Callis.
I'm present.
Mark Goodman.
Yes, I'm present. Can you hear me?
Yes, I can hear you, Mark.
Great. Thank you.
Matthew Golker.
Present.
Jessica Hamilton.
Present.
Edward Hunter.
Here.
Tiffany Johnson.
Here.
Sarah Kirk. I do not see Sarah. Christopher Leonard.
Here.
Jay Middleton.
Here.
And Doug Wright. I do not see Doug. I note the following staff member is present: David Fye.
Here.
And Leslie Allen will be joining us in a bit. Next, David Fye will read a message concerning this meeting being held remotely. Dave.
Thank you, Richard. This is David Fye, Executive Director for the Behavioral Sciences Regulatory Board. Public comment allows the public to address the advisory committee about its concerns, but the Kansas Open Meeting Act, or KOMA, does not require the advisory committee to provide public comment or answer questions from individuals. Individuals wishing to provide public comment could contact the executive director prior to the meeting by sending an email to david.fye@ks.gov. There will be no time for public comment as no individuals requested time for public comment. Because we are conducting the public meeting remotely by conference call and other teleconference ability, I state for the record the following information. Public access to this meeting is being conducted by medium of interactive communication that allows members of the public without cost to attend the meeting through the use of the conference call or by viewing the board's YouTube channel. While the meeting is conducted remotely, the requirements of KOMA are not suspended. Therefore, we will be conducting this meeting pursuant to the KOMA. On March 12th, 2025, and later for the rescheduling of this meeting, we sent notice of the advisory committee meetings to all individuals who had requested notice of the advisory committee meeting. The notice was also posted on the board's website, ksbsrb.ks.gov. You may obtain a copy of the notice at that copy of the notice at the website. You may also obtain a copy of any agenda and meeting materials which have been posted on the website and are available for review. You may also request a copy of the agenda specifically by sending an email to david.fye@ks.gov with the subject line request for the agenda, and it will be sent to you. The notice contains information for the conference call and YouTube channel that allows the public to attend the meeting free of charge. The notice also states that if we have any technical issues during the meeting, you may contact the board office by sending an email to bsrb@ks.gov. A recording of this meeting will be available on the BSRB YouTube channel following the conclusion of the meeting by using the link to the meeting on the agenda. And I did check the conference call line before we got started. No one was on the conference call line, but if I hear someone beep over and introduce themselves, I will let you know.
Thank you very much. And if I could take a quick moment of personal privilege, I want to thank all of you for your flexibility in rescheduling this meeting. This meeting was originally scheduled for 2 Tuesdays ago. I had a matter that came up and I could not be here, so I really appreciate your flexibility. And the meeting is now called to order, and the advisory committee will begin its discussion of the first item on the agenda, and that is the approval of the agenda.
And Richard, I just wanted to note as well, David Stevens is in attendance. And so
yes,
this for the meeting as well.
Thank you. I'll take a motion to approve the agenda.
So moved.
Linda moves. Do I have a second?
Second.
Mark seconded. All those in favor, please say aye.
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 All those opposed, same sign. The agenda is approved, and now we'll move on to any review and the approval of the minutes from the last meeting, which was held on the 11th of February, 2025. Everyone has received a copy of the meeting minutes twice now, and if there are any questions, please do field them. Seeing none, I'll take a motion to approve the minutes from February's meeting.
I approve.
Mark moves. Do I have a second?
Second.
Second.
That was Chris and Linda. All those in favor, please say aye.
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 All those opposed, same sign. The meeting minutes from the February 2025 meeting have been approved, and we'll move on to our next agenda item, which is the executive director's report. Please take it away.
All right, thank you, Richard. Well, first I'll go ahead and start with some BSRB operations updates, and then we'll talk a little bit about legislative updates, and then items for the last board meeting. So concerning recent operations updates, one item you'll see in your agenda a little bit later on is the review of the draft survey report for licensees. And we did put together different surveys for 6 of the professions that we regulate. We had previously done surveys for the social work profession, but we wanted to give all the other professions the opportunity to create surveys for their professions as well. And we had different questions per level of licensing, but we also strived in the final versions of the questions to have language that was similar so that we could have a different summary report per profession, and then also a comparative report across professions. And I was really pleased with the turnout that we received in terms of how many people filled out the survey. Really happy with the responses that we got back, some very thoughtful answers, some positive comments, some critical comments, but I think you take the full range when you ask questions like this. And I think the information that we received will be really helpful for the board and the advisory committees and our work going forward. So that has taken up a fair amount of our time, but I want to say special thanks to Tyla and Emma. They have been very, very helpful in terms of creating those draft survey reports, summarizing a lot of the information. We've been taking steps forward as we learn how to examine and compare data. And in the past, for our survey reports, we've followed pretty simple mechanics in terms of providing information. This time, we're really trying to summarize, but we also wanted to provide as much of the voice of the individuals who responded to the survey as possible. So you'll see when we get to the survey reports, the first quarter of the report really focuses on our takeaways. And then the remaining pages of the report are appendices with specific answers to those questions. So I think both are very, very important. And I'm looking forward to our walkthrough of that during the meeting today. Aside from that, we are just getting ready for a lot of the mid-year meetings, and we're right in the middle of a couple of those. Last week, I attended the mid-year meeting with for the Association of State and Provincial Psychology Boards, and I was there with public member David Stevens. I was asked to present on a couple different topics, and so I talked about the composite nature of our board in comparison to some of the models in other states and what recent changes they have faced. And then I also talked about customer service. So I was honored to be asked to speak on those topics, and I think the presentations were well received, but I'll talk more about that when we talk about that item on the agenda. Next week, I will be out of the office, or actually in the next few days, I'll be out of the office for the mid-year meeting for the Association of Social Work Boards. And so I'll be back in the office on Monday, but staff here are doing a wonderful job keeping everything going smoothly. So, turning to some legislative updates, the legislature has finished their session for 2025. You may recall in previous years, the legislature had a 90-day target in which they tried to finish all of their work in those 90 days, but the calculation for the 90 days sometimes changed year by year. And so I have seen legislative sessions go as late as the middle of June. Some go towards the beginning of May. This session, they really wanted to hit the ground running and finish as quickly as possible. And so they wrapped up just about, I think, 2 weeks ago. And they did not set an additional last day to do veto overrides. Sometimes that is a process that happens, but they went ahead and passed a number of bills, and then were gone for about 10 days to allow the governor to review those bills. And then they came back and did consider certain bills. A few of the things the legislature did this session, they did pass an appropriations bill for the BSRB. We had requested certain amounts in our budget that we submitted back in September. Ultimately, the legislature agreed with these same amounts that we had proposed. We came in under budget compared to what we were approved for last year for this current fiscal year. And that is what we had told the legislature. We said we had tried to estimate things like inflationary cost. And if we needed additional expenditure authority, we would request that. But if we could find savings, we would do that as well. And so as a showing of good faith, we did that. We came in about $40,000 below what we had been approved for. And if we don't spend that money, it just stays in the BSRB fee fund. And the more that we can save while still maintaining operations and doing what we need to, the more time it will take before we need to consider any kind of upward fee adjustment. So really happy with what occurred during the budget hearing process. Our budget was heard in the House Higher Education Budget Committee. They made no changes to the budget. It was passed in the House Appropriations Bill. It was sent to the Senate, and the Senate didn't make any further adjustments. So the budget was approved. In terms of bills affecting the BSRB, unfortunately, because of some technical issues, we had submitted some proposed changes in statute, and we had put forward information to request as a bill before the legislature this year. But unfortunately, because of the volume of bill drafts the Reviser of Statutes office received, we were not able to get our bill introduced this year and worked through committees. But the bill is ready to be worked next year, and I'm optimistic based on my conversations with both the House and the Senate and the positive comments on the items that we have to be moved forward, that I'm optimistic we'll be able to get that bill passed next session. In terms of other bills that would affect the BSRB, there is one bill that will reduce the revenue from the agency by a certain amount. There are some savings for certain individuals, military members and military spouses, when they are seeking licensure in Kansas for professional licenses. And there was a bill that went through the legislature this year that previously the statutes had exempted military spouses of active duty military members. This bill this year exempts military spouses of military members, whether they are active duty or not, from having to pay licensure costs for certain fees. So that will reduce our revenue. That's not a category of individuals that we have tracked historically. So we did notify the Division of Budget that we would see a decrease in revenue, but I believe that we'll be able to absorb that without having to make any changes. There is also a bill that was called the Help Not Harm Act, and it was somewhat confusing. I believe it was Senate Bill 63. And we have discussed that bill a couple times in the past. We are still working through that with legal counsel for the board to see what information we can share with licensees. Some of the information in that bill restricted certain medical procedures from being performed on certain gender-affirming care for minors, and talked about prohibitions about prescribing, but it also included some language that dealt with healthcare providers and healthcare services. And so to make sure we have a good understanding of that, we are continuing to I'm sorry, can you hear me all right?
Yes.
Okay. Apologies about that. We are also making some technology changes here in the office, and we are moving new laptops. And unfortunately, sometimes when that occurs, we have to work through some different issues. But in terms of the legislative item, that bill, Senate Bill 63, we are still working on that. The board is meeting here in about a week and a half on May 12th, and the board may have some additional discussion on that bill. But ultimately, we're still working through that to make sure that we have a good understanding of the board's responsibility or if it would affect BSRB licensees. So more information to come, but we're still working on that item. And then in terms of items from the last board meeting, the one item I wanted to talk to you about from the board meeting that took place in March is that you have dedicated a lot of time as an advisory committee, as have the others, to the review of the unprofessional conduct for the profession. You may recall when we started this process, some of the unprofessional conduct regulations had not been changed in over 20 years. And the advisory committees really spent a good amount of time going through those, making recommendations, looking to see what other advisory committees had done, looking to the ethics codes of the associations, and then putting those before the board. And so taking all of those recommended changes here in our office, I worked with certain staff members, and I want to say a special thank you to Misty, one of our staff members here. Misty did some excellent work helping me put together a grid of all of the unprofessional conduct regulations so that we could see similar regulations side by side. And in that grid, you can see a lot of the common items, 7 different sets of language across the board. And I think the board now will be going through those items to determine if they want to standardize the language for some of those items, or if they want to allow some differences by profession if there are some unique aspects. For example, in terms of psychological testing, some of that may not apply to the scope of practice with the other professions. So the same is true for some of the other professions. They may have a couple of different items that are unique, but this will be a nice way for the board to kind of think up some of this language that is slightly different, and then have a nice set of clean regulations moving forward. So that is a big item the board was working on at the last board meeting. I anticipate the board will continue to work on that through this year with the ultimate goal to forward that through and have some really good unprofessional conduct regulations that might require minor modifications, but not the major lift that we've been doing the last few years. So with that, I will go ahead and end my report and see if there's any questions.
Any questions for Dave with respect to his report?
I guess being new, I just had a couple questions with the legislation in the session. So the stuff that we've been working on that was sent up for the statutes, that just is on hold until when? Their next session?
Yeah, so the legislature works on a 2-year, I believe it's usually called a biennium. And so in the first year, which is what we had this year, you have different, so officially only members of the legislature can introduce bills. And so what you need to have happen is if you're someone like us from a regulatory board, you would need permission from a member of the legislature to work with someone from the reviser of statutes office who actually drafts the law. And so we did receive that back in, I believe, December to work with a member of the reviser's office and take the board recommendations and translate those into draft statutory language. And so we worked with a member of the reviser's office. We provided that to them. The board met in January and we finalized any last recommendations. And then ultimately what happens is the reviser of statutes office puts together the version of the bill that's ready. And then we need to have a member of the, they need to provide us a number. It's not the bill number, but it's an RS number. And then we need to have a member of a committee ask for that to be introduced during one of the committees before a certain deadline. And then some of the committees will allow representatives from different groups to come to the microphone and request those, but a lot of them say it has to come from a member of the committee. And we had lined that up, but unfortunately, even though we had provided the information to the reviser's office at the beginning of January, they had not provided us with the RS information or the final draft until it was too late for us to basically get that introduced in the committee. And so we explored some alternate ways to get it introduced. There are some committees that don't have to follow that deadline. They're called exempt committees, like the House Appropriations and Senate Ways and Means Committee, and they can introduce bills the entire session. But unfortunately, what we had heard is that in their interest to move really quickly this year, they wanted to limit at least the number of bills that were coming forward so they could finish the session as quickly as possible. And so while the bill was ready, it wasn't able to be introduced. So since it wasn't introduced, it is still there, it's ready. It's just, it will still be available when the next session starts. We'll just have to have the bill introduced in the committee. It'll be assigned a bill number like House Bill 25 or Senate Bill, whatever. And then it'll be assigned to one of the health committees. Most likely that's where most of our bills are assigned. And then we will request a hearing from the chair of that committee. And that's when we'll get the opportunity to talk in favor of the bill and present testimony. So unfortunately, this is the first time that I have seen this happen, but it was a bit of a breakdown, and I take a lot of the responsibility for this. You know, I know how much work the members of the reviser's office do and legislative research. I spent about 8 years working for the research office prior to taking this position, and so I know that they get slammed with a lot of work. And so I was trying to take a hands-off approach and just kind of let them do their work and not be the squeaky wheel. But next year I'll take a different approach, especially as we get closer to some of those deadlines. It's just there's long-term relationships and short-term relationships, and it's all part of the process. So live and learn, but also I really respect the work that they do. It's definitely not a slight to them. It's just unfortunately what happened this year.
Any other questions regarding the executive director's report? Seeing none, thank you, Dave, for the report, and I'll ask you now to begin the updates for the mid-year meeting that was held for ASPPB.
And thank you, Richard. I was fortunate to be able to attend the mid-year meeting for ASPPB. That was actually in Montreal, Canada. So ASPPB and the association that really helps regulatory boards. It helps out the regulatory boards in the United States, but also the territories and also the Canadian provinces. And this is the first time since I have been at the board that one of these meetings was scheduled in one of the Canadian provinces. So went to Montreal, and public board member David Stevens was able to go as well. As I mentioned during my executive director report, I was asked to speak on a couple of different topics. So I was part of a panel that talked about composition of boards. There are some states that have independent boards, some that have recently moved towards consolidation under umbrellas or by having one board like we have here in Kansas. And then I was also asked to speak on public service. And so I spent part of that time talking about our survey, part of that time also talking about some of the things that we do here in the office. Some of the things that we may just take for granted, such as picking up the phone, is not something that occurs in every state office. And so sometimes we don't even hear about that we're different until we hear from people that are licensed in multiple states, and they seem surprised that they're actually talking to a real person when they call our office. But that is something we take pride in. We try to think outside the box too. Some of the things that we've scheduled the last few years as far as our informational presentations to educators and also employers, the YouTube channel where we're broadcasting meetings and getting more access and for individuals to follow the work of the board and the advisory committee. I was happy to speak upon a lot of those different things, and I think we got a lot of really positive comments about the survey and the information that we put out there. And I did let them know it is still in draft form and to expect it here in about maybe another month or month and a half. But everybody was pretty excited about the survey results as well. And so happy to share that information. Some of the takeaways that I think from the conference, people are also collecting other workforce data. People are trying to get an idea of what the workforce is going to look like in the coming years. And so some of that information was being provided about, here in the United States, but some of it was also being provided in terms of the Canadian provinces. Canada, actually, some of their representatives were saying that one thing they're trying to do is to make it easier for people to come from the United States to practice into Canada. So I found that to be kind of interesting. We talked a little bit in our administrator meeting about some of the multi-state compacts and some of the different ways that people are able to practice in different states now and the changing demographic, and how we'll have to start looking at workforce a little bit differently because of people providing services across state lines instead of providing most of their services in one state. So that was kind of interesting. We also talked about unprofessional conduct and which groups have really modeled things after the ethics codes versus which groups have done something differently. I thought it was kind of interesting. Some of the states basically said that they essentially adopted the ethics code of certain associations, but they didn't like certain versions. So I think there was one state that didn't like the current version of the ethics code, so they adopted a past version from maybe 2010 or so. And then someone else, they liked it, but they didn't like that version either. So they liked the version from 2002 or somewhere around that time period. So I found that to be kind of interesting. One of the reasons why we don't adopt an ethics code and why we use some of the language and it influences the items, but we don't adopt the code is because we don't want to give up our jurisdiction and our authority to a third party. And so our legal counsel in the past has basically said, you can use the same language, those items are just items. But if you say, we're going to use this as our ethics or as our unprofessional conduct, then you are bound by that. And if it changes, you could be bound to something that changes that you don't agree with. So that's why we do things the way that we have done them historically in Kansas. But I thought the conference was good. This is a shorter conference than the annual conference. It does a little bit of the work of the association in terms of talking about opportunities to volunteer for the association. I serve as a member of one of the committees, as does David Stevens. So it was nice to see some of the staff members of ASPPB. And there was also a lot of conversation at this meeting. I should say there's two main groups that are meeting this year that focus on issues that came up in previous years. One of those is focused on the EPPP, the licensing examination. We did a lot of discussion about that last year. And there was the At the time, there was the upcoming requirement for both tests to be required as of January 1st, 2026. And then that came to a head at the annual meeting last year, where there was a proposal to be put in the bylaws for ASPPB to make that optional between states. Ultimately, the board of ASPPB rolled back that requirement, so it's not going to be required. And in fact, the EPPP2 as a separate item is going to be probably phased out. What we are hearing for the task group that is working on the EPPP licensing examination, we're hearing that they have a target of late 2027. And what they hope to do is have one integrated examination with knowledge-based questions and also an assessment of skills as one test. There were questions that they were posed that had to deal with any kind of cost estimate, and they couldn't answer those at this point. So we'll have to wait and see in terms of how that test is going to look at the end. But I think they're making a real concerted effort to make it one examination versus what they did last year, which was to take two examinations and push them together and call it one. So I really feel like the final product will be a much better product, and it'll have a lot more input from states and jurisdictions. Separately, the process by which that bylaw amendment came forward was very bumpy. I don't believe anyone had ever proposed a bylaw amendment to the ASPPB Association in the past. And there were a lot of strong words between different states and Canadian provinces and territories, some even saying that bringing something like that forward was mutiny, which, you know, to me, I've seen a lot of organizations change over the years, and I value that intelligent minds can agree to disagree. So I'm glad that we were supportive of the bylaw amendment, and I'm glad that the change occurred, even though it was bumpy. But one of the items that we pushed for was a modification to the ASPPB bylaws, so that when there was a need for the body to make future decisions, we could have that as a smoother process. So I'm working with about 15 other people on a task force specifically dedicated to the bylaws of ASPPB. They have not been updated since about 2013, so they're definitely due for some changes. And I think some individuals have also expressed that they would like there to be more transparency during those board meetings and allow more individuals to see and hear the work of the board and the comments and the discussion that goes into those decisions. So that task group is working as well. And we're hopeful that we can put forward some recommendations by July. That way they can be considered at the annual meeting this year. So those were my major takeaways from the meeting. I will defer to David Stevens if he's able to share any thoughts or comments on any of the sessions that he attended, if he would like to do so as well. And if not, I just want to say again that I was very thankful that he attended the conference. I know, Richard, you and Linda were unable to attend the mid-year meeting, but you've attended the annual meeting before and really appreciated when board members can attend these conferences. I think, I know you have other different responsibilities in your day-to-day lives, but I really appreciate your service on the board and really appreciate you all and how much you give back, and happy to assist you. So we'll have more opportunities to attend these annual meetings, and I will help you with that if you're able to attend the annual meeting later this year.
Hey,
I want
David,
to say
can you hear me?
thanks for that opportunity. Sorry, David. David Stevens, sorry. I always learn something when I go there. So I appreciate the opportunity to go. Thank you. All right, David Stevens, you're on.
Okay, sorry, I'm sorry, I'm mobile right now, so I'm listening, but can't really be on camera. But I just wanted to say I appreciated getting to go. And I wanted to highlight, I mean, David is just such a well-respected attendee of these events, and I think that represents our state well, and it helps in all aspects of, the administration of the Kansas BSRB, that he's as plugged into these things as he is. So, it's always fun to see a professional at work.
Thank you. Appreciate that.
I just had one comment. This is Mark. I'm real familiar with Canada, and it would really be neat someday if we'd be able to provide services in the Canadian provinces. I happen we have a house in Newfoundland, so I go up there fairly regularly. And there's a very dire need for mental health professionals in that province and throughout much of Canada. I just want to just share that thought that I'm hoping someday that could be a reality, that we could go up there and provide those services.
Thank you, Mark, and I appreciate those comments. I know that people had questions about the Canadian provinces when FIPAC was originally going through. The nature of that agreement is a multi-state agreement, and it's just for the United States. So unfortunately, Canada can't really participate in that, but perhaps someday there'll be an agreement between the U.S. and Canada to allow something similar to FIPAC. So we'll have to
be wonderful. It would happen, in my opinion. And again, I've had the fortune of being able to travel all throughout the country, and we've been up in Newfoundland for, like I said, 17 years. We've had a house up there, and great people.
I also had the poutine and some maple syrup. I always try to try the local things.
That's great.
So it was nice. Good,
Yes.
I am sorry to have missed the meeting. If I had not had the passport issue that I had, I would have attended. So thank you, David, for attending the mid-year meeting. As a point of information, the annual meeting this year is being held in November. I believe that it's November 15th and 16th, 2025. And I am forgetting the city that it's going to be in. Is it in DC this year, Dave? Or is that in Texas?
Actually, I think it's going to be in St. Louis.
Oh.
So I think the FIPAC meeting, I believe, is going to be in a different spot, but I believe the annual meeting this year for ASPPB will be in St. Louis.
Okay. And yes, I am mixing that up with the SciPac meeting, which is going to be later on in the year also. So thank you for providing that information.
Yep.
Any other questions for David Fye regarding the mid-year meeting? Seeing none, I'll move us over to our next agenda item, and that's an update on the SciPac multi-state compact. I had pulled up an email, and I am not able to find it now, but it contained information about the number of unique licensees from across the country that are practicing in the state of Kansas via SciPac. And what the email said, I do remember the numbers. There are 62 individuals who have indicated in their annual updating of their ability to practice telepsychology. There are 62 folks from across the country that are practicing in the state of Kansas. There's one person who has a Kansas license who's also a SciPac member that's practicing in the state of Kansas. And I believe that David also sent over numbers to SciPac. They have requested the number of psychologists that are practicing in the state of Kansas. And I believe that as of March 2025, the end of last month, there were 1,058 psychologists. I don't have the number directly in front of me, but I believe that is the case. That's the number of psychologists in the state of Kansas. I'll turn it over to David Fye to ask him if there's anything that I missed in that. Again, I don't have the email in front of me, but that is what I remember from the email.
Yeah, no, I think that's great information. The only thing I'll say is I did a little bit of analysis in terms of what states are the most prevalent in terms of who's providing services into Kansas. And one of the biggest ones is Texas with 11 different providers. Colorado is a bordering state, about 7. And those are probably the 2 highest. And then there's about maybe 5 from Illinois, probably about 5 or 6 from Missouri, and then a handful from other states, usually 1 or 2. But just always interesting to see, who's providing services into Kansas. The states that would not be included on here would be the non-SIPAC states. There's still maybe around 8 states that have not joined SIPAC. But as we have looked into the numbers in terms of how many licensees we've lost because of SIPAC, how many out-of-state licensees, we had concerns about some of the revenue decrease that we would lose when we would lose those licensees. And there have been some, but also in terms of who's serving the citizens of Kansas, it's helpful to see the number that you mentioned, Richard, of the 62 individuals who are providing services into Kansas, because those are additional people who, if they're not licensed in Kansas, those 61 of the 62 are providing additional services into the state purely because of the compact. So that's a nice benefit to the citizens of Kansas. Their needs are being met by those other individuals as well. So appreciate you sharing that information. And that's all that I had as far as extra information on SIPAC.
Thank you very much.
I think it's interesting that the majority of those come from Texas and not from Colorado, Oklahoma, or Missouri. I mean, that's interesting.
Mm-hmm.
Especially Missouri with Kansas City being right there.
Yeah, I would have expected Missouri to be the most common one. And this is, so as people are renewing their SIPAC privileges, they come up there's a different group per quarter. So this is for the first quarter of 2025. And so I'll look at the numbers as we go forward and see if we have similar results, or perhaps there was just a bigger portion that happened to all be from that state for that quarter.
And I think the same email that Gina Polk sent over, she's the specialist that works with SIPAC, who provides us with these numbers. I think that it was, or in the numbers that you went through, David, the analysis that you did, I think that there were like 23 or 24 states that are represented in the 62 62 psychologists that renewed their privilege in Q1. Am I remembering that correctly?
Yes, that is correct.
So a variety of states, and more than 50% of those states that are in SIPAC is represented in our numbers from the first quarter of 2025. Any other questions or comments about the SIPAC update? Seeing none, I'll move us on to old business. And the only item we have under old business is the review of the possible changes to the postdoc year requirement. Dave, I'll turn it over to you.
Okay. Thank you, Richard. And members of the advisory committee, as you may recall, there was a representative from the Kansas Psychological Association who had requested some time for public comment. And also, I believe a licensed applicant had requested some time for public comment a couple of meetings ago. And they had talked about some of the requirements for licensure. One of the items that was specifically highlighted was the 1 year, the postdoc year requirement in Kansas. And there was a request for more flexibility, not to eliminate the year, but perhaps for people to be able to start the year earlier, or other flexibilities along those lines. And so at one of the last meetings, the members of the advisory committee were supportive of some increased flexibility on this item, and asked Leslie if she would go ahead and draft some language to kind of show how this could be implemented. There was also a question, I believe, as far as if this would require a statutory change or just a change to the regulation. And I think, Leslie, feel free to correct me if I'm misremembering our conversation, but I believe when we looked at this issue, it was your understanding that this could be done through the regulations without requiring a change. I do seem to recall that maybe you had some questions for the members of the advisory committee. So I will go ahead and share the draft that you all should have in your copy for materials for the meeting, so you can see the language that Leslie had marked up here. If you do have questions or comments, go ahead and feel free to voice those as we talk through this. We may not be able to see your hand because we're sharing the document. So,
that's what I was going to say, and I can't put on my glasses and read, so please speak up.
Yeah, so Leslie, is the font size a good size?
Yeah, I have a copy on my lap, so we're good.
Perfect.
So the first thing is just changing in A, changing to 2 years and 3,600 hours of supervised experience. And then at least 1 year and 1,800 hours have to be a pre-doctoral internship that meets the requirements in B below. And the remaining year and 1,800 hours of supervised experience shall be pre-doctoral, postdoctoral, or a combination of pre and postdoctoral supervised experience. And as I was reading different states, they have different, I mean, they all kind of have their own requirements on what they will accept. And so I have some questions for the committee. Because one state says the first year in a doctoral program, those practicum experiences don't count toward the experience requirements. Another state says the first year of a doctoral program doesn't count unless they had a master's degree in psychology. From the program that they're attending. So I don't know enough about your doctoral programs to make that kind of call. So I kind of left the specific requirements if they should mimic like an internship. Should the supervision be 1 to 10 hours? Should it be less? Less direct hours before supervision? You know what the let's see. And a lot of states said they allow if someone completed a 2,000 hour internship that they could add those hours onto the other required 1,800 hours. However, if you did that, that would affect the 2-year requirement. So I don't know if you're more interested in hours or time spent, or if you want them, you know, to be 24 months and 3,600 hours. I did see some people require a contract for training and practicum. I saw different language for pre-internship, practicum, internship. So that again would be up to the committee on kind of how you want to present the language. And those were kind of my questions about how you wanted to proceed. I didn't want to list a bunch of requirements because I don't know that much about practicum in doctoral programs. So I thought you guys would be better at letting me know if it should, you know, follow the same lines of an internship or if it's much more restricted in the practicum before the internship.
So there are a number, and thank you, Leslie, for the presentation. There are a
Sure.
number of questions that have been proposed. I did not get all of them down, but
Oh,
Leslie had made mention of the restriction regarding what years would count towards the requirement if we were to allow predoctoral time to be rolled into the 3,600 hours. There's a question on the table regarding the number of supervision hours that should be required for predoctoral hours accrued. There's also the question regarding whether or not we would want to have break things up in terms of the 3,600 hour requirement, or do we want to pay more attention to the sort of time spent, so the 2 years versus 3,600 hours, if I got that correctly? And Leslie, please let me know if there are other questions that should be on the table.
no, that's pretty much it. And the requirements in the practicum. I did print off 2 things from the ASPPB website. I have resources for regulation of practicum experience that I could forward to the committee if they wanted to look at that. And then just the model regulations for licensure of psychologists. They're both, pretty thick booklets, although, yeah, they're two-sided. So if you would like to look at those, I'd be happy to forward them to the committee. And we can put a link, in the meeting documents so that since it's a public meeting.
No, I think that would be great if you were to send it to the members of the committee.
Okay.
Seeing that there are a few questions here and being mindful of the time, and I know that a number of these questions could take a fair bit of time in terms of discussion, and we could what we could do is begin a discussion regarding the questions and then return to it in our next advisory committee in June. How does that sound for folks? Well, seeing no concerns or no questions about that, maybe we can go kind of in chronological order. And that's the question regarding the restriction, or should there be restrictions in terms of what year the accrual can begin? Would it begin at the very beginning of someone's graduate school career, so year one, or would there be would we want to see it restricted to year 2 and above or year 3 and above? Any thoughts about that question that she has brought forward?
I don't know if it's a valid concern, so somebody in the university world might have to address this, but are we certain that practicum experiences in doctoral programs that are APA accredited meet the same criteria that APA accredited internship programs meet? So like if your doctoral program is APA accredited, is there some sort of oversight over your practicum site while you're in your program that would make it equivalent to an APA accredited internship site? So that would be my concern. If you go back into your program, you're counting experiences that might not fall under a criteria such as APA accreditation.
I went to Wichita State's APA accreditation review when they were getting the renewal, I guess. I don't know what to describe it. And one of the things that the accreditors came and discussed is like, are there evaluations mid-year, final year? And Wichita State has those, which are very similar to our internship that's APA accredited too. We have a couple more evaluations. There's live observations that they request and ways to document that their notes are being reviewed and things like that. So I would think most APA requirements, internship and training sites and programs would have some review in it, because that's what they were asking at the meeting.
So I think that would have been my primary concern, I think, is ensuring that we had some sort of certainty that the program experience is going to mirror or be similar to what you get during internship. If we feel okay about that, then I've got some flexibility in it, I think.
Yeah, I wish we had Sarah Kirk here because she could speak.
Yeah.
That's what I was thinking.
Yeah, I was thinking that too.
I mean, there are a lot of, it seems like there are a lot of these questions that are intermingled with one another. I think that we're talking about, if it's pre-doctoral, practicum experiences, a very different nature of training than what somebody has received or who had completed a postdoctoral fellowship. So, I think they're not all of a piece. So if we talk about the same experiences on a internship at the practicum level, no, the experiences are quite different given the level of training and so on. So yeah, So I think there are a lot of issues bound up together here and hard to tease apart.
I
I
appreciate.
also, oh,
Oh, go ahead, Leslie, please.
I was thinking when I printed everything off, I also made a document with just the internship requirements from the education regulation if a program is not APA accredited. So I will send that language to the committee as well to see what we already have in regulation for internship.
Thank you.
Yeah, I agree with Edward. I would say practicum experiences are different. I think there's that developmental component. I think the one thing that would maybe make them somewhat similar is that the person providing the supervision is providing it as a licensed provider or under the supervision of a licensed provider. I think that maybe is the thing that I think can bridge them better. But yeah, you wouldn't expect a postdoc and a first year practicum to be at the same level of conceptualization. So.
And may I ask how many hours of practicum a psychology student would receive in a normal PhD program?
Yeah, see, that's
Does it just
a lot. You review applications for appies. I've had students come in with 200 hours and students come in with 1,200. And so
okay?
Yeah, that is the number, the spread on that can be significant. And just out of people in my graduating cohort 15 years ago or whatever, yeah, some of us had 500. Some people came in like with what Abby just said. Some people left with 350. Some people left with 1,000 before internship. That's what I mean by leaving.
Yeah, what is also being considered in the 1800? Because, I mean, say you have a practicum 1 year that's a day and a half, how many actual contact hours are you having? That's what I think varies widely.
Yes.
Isn't defined, pretty clearly. You could end up having people that are doing a lot of didactic activities in their practicum and not really getting clinical experience. I think that's a significant issue that needs to be addressed.
I concur with Ned on that. That a lot of people get didactic training or they do observations, but they're not actually engaged. They're not engaged in the provision of clinical services.
That's also true at the internship level, and and why it's defined that I guess in Kansas it needs to be $900. I'm sorry, $900, 900 hours of direct patient contact of those 1,800. So it's how are we going to count that 1,800? I think is the real issue. What does that really mean at the practicum level? I don't know the answer, but I think it needs to be defined in some way.
Right. One of the states I looked at said that at least 25% of the trainee's time shall be spent in direct client contact. So they do. I think that is something that is being worked out in the regs in other places too.
Yeah, I'm sorry, go ahead.
No, so that's what I wanted to get ratios of appropriate ratios for how much time in direct client contact and also the ratio of supervision to direct client contact.
Was that
clinical services?
Yeah, was that in another state, Leslie, that you're talking about, that 25?
The 25%, yes.
Which,
And then,
sorry.
huh? No, go ahead with what?
I was just going to say, which is substantially different, certainly than the internship, and postdoc as well. So again, yeah, beating a dead horse, yeah.
would we have the ability to just make I don't know if this is a good idea, but would we have the ability just to match the ratio? So like if we said the ratio at the internship this, that if we were going to accept something prior to an internship year, the ratio has to match. And it has to be documented somehow in some sort of way that's acceptable.
I like that a lot.
I mean, honestly, we'd probably end up ruling out quite a few people who even went that direction, because I don't know that anybody's documenting in the same way.
That part,
That might
what
solve.
you just said, yeah, that I don't know if there's anyone who is doing, when it comes to practicum or practica, if they are doing that level of monitoring of the ratio like you would do on internship. And I agree with you, Abby, that would probably rule out a whole number of people, because if there's insufficient documentation of the ratio, then
Yeah.
clearly we
Well,
would not accept those hours.
and just speaking in a center who does, well, I'm not there anymore, but we had bachelor's, master's, doctoral, just all three in a line. And while they all got really quite similar experiences, the documentation requirements were different. We certainly did different documentation on each group because schools require different things, and it was definitely less rigorous. So we wouldn't have been able, I think, even to meet that criteria. And I was pretty careful about designing that, and I don't think I could have met it. Just as an aside.
I also like the language that included that you needed to have your master's equivalent before those hours started accruing. I know that some PhD programs, you get your master's in the course of getting your doctorate degree, where other people might start with their master's as they are entering into their PhD program. But I think, recognizing that that they do need to have that level of experience prior to us starting to count their hours towards their PhD license, I think is appropriate. I think your first year, it would help with that first year practicum experience not being quite as heavy at direct patient hours probably as well. And I know for us at KU, I require a master's before I start allowing them to do their advanced practicums, just for experience at the med center.
I know that where I went to school at the University of Washington, there were a few people who got their PhD but never got their master's. Like they didn't submit the paperwork to get the master's degree, and that may be something to further consider. I do think that it would probably be best to have a master's. Just this is personal opinion. It would probably be best to have a master's before the hours begin to accrue, because usually it's after the master's where you go to, as Jessica was saying, like you're in advanced practicum at that juncture. Like the first couple of years, you may be in a beginning intermediate practicum, but after your master's degree, you would most likely be at an more advanced level, and that would more mimic the experiences that you might get on internship in that regard. So
I totally agree with you. I went from a bachelor's degree straight into a PhD program back in 1971. I was very lucky to get accepted, and I would be nowhere trained. I wouldn't know what was going on if I went into a practicum straight, in my situation, from a bachelor's straight into a PhD program. I totally agree with you.
So you could write, I mean, the regulation could be written that it could be either advanced practicum could count toward the hours, or, the first year doesn't count, or if you have a master's, it may, you may count it. So there's you can have different requirements that get to the same ability to count hours.
And I want to be a little mindful of the time, because we do have the survey to discuss. And if I remember, David, we had talked about that discussion probably taking, what did we say, 45 minutes?
I think so. I think about 45 minutes if there's questions. Yeah.
So we are at 7:05. would folks like to would folks like to table the discussion that we're having now and return so that we can start hearing a bit more about the surveys? Okay, so let's do that. I think this is the beginning of a really productive discussion, and I definitely would like to return to it because there are a number of questions that still kind of remain on the table. And this question, well, it has not been resolved. So I think that
Can I ask a quick question here?
Yeah, Jess.
Is there a way, Leslie, that we could get like a spreadsheet of some of these, the way things have been laid out, that you've already been so kind to do some of that investigative work for us, and that maybe between now and the next time we have the opportunity to kind of look at that, and come up with, hopefully next time, a list of options that maybe we could vote on, because I can see us just kind of going in circles around language and how many of these different options there are. And so maybe if we have the opportunity to look at it and then come up with a list of options and then vote on which one we think might be ideal over the course of several meetings. But that way we're moving forward rather than maybe circular conversations.
Sure, I can work on something like that.
Thank you, Jessica. I really like that idea, and thank you, Leslie. I want to reiterate what Jessica said in terms of the work that you've already put into this is greatly appreciated. And yes, if we could if we can begin to return to this in our next time together, that would be great.
Okay. Thank you guys very much.
No, thank you. So I will move us on to the next, not the next agenda item, but the one thereafter, because the first one is the discussion of the ASPPB Town Hall, and maybe we can finish with that if we have time. But I'll buzz over to point 8, subpoint B, and that is the review and the discussion of the survey. Dave, I'll have you take it away.
Thank you, Richard. As I discussed earlier in my report, one of the major items we've been working on behind the scenes has been putting together draft reports from all the survey information. And so you received a copy of the draft report and your materials, and I will go ahead and share my screen and we can just walk through this together. And then we'll see if you have any questions over the information. As I mentioned, this is a draft report and we anticipate making some further changes. But I'm pretty pleased with some of the direction. I've been working with a couple of my staff members on this and really got a lot of good feedback from our licensees. So the first page of the report after the cover just kind of talks about the methodology. It mentions that we had looked at creating questions for a survey back in 2024, and the advisory committee had talked about a number of different topics. But as we were doing similar surveys for most of the other professions, we did strive to include things that were relevant to all the professions, but the final versions of the questions, we tried to have some level of consistency so that way we could have a report not only for each profession, but also to do a comparative report across professions. It talks about the survey being open as of January 24th in 2025 through February 23rd, 25. So it was open for about 31 days. And in Kansas, when we started this process back in January, there were about 1,047 licensed psychologists in Kansas. And so we talked a little bit about the methodology that we used in terms of using SurveyMonkey, that the results were anonymous, but even with the results being anonymous, we were still able to send some targeted reminders to individuals who had not completed the survey. As much as possible, we tried to preserve the voices of the individuals who completed the survey while removing a little bit of information here and there to make sure that we kept it anonymous. The people provided self-identifying information or other things that could have affected the anonymity of the information. So But over the 31 days, the survey was open for responses. For psychologists, we received feedback from 297 individuals for an overall response rate of about 28.4%, which for a voluntary survey is a really good number. So really pleased with that response rate. Two of the main things that we looked at in the survey, we tried to collect information on workforce, but also information that goes more to the work of the advisory committee as it relates to the work of the board and protecting the public. But one of the items we generally start off with in the surveys is to make sure we have a good sampling of individuals around the state. So we asked individuals question 1, in what Kansas county or counties do you practice the profession of psychology? The majority of individuals referenced a combination of different counties, but for the ones who mentioned a single county, as you might imagine, the most commonly referenced ones were Johnson, Sedgwick, Douglas, some of the major population centers around the state. Question 2, do you practice predominantly in an urban area, rural area, or frontier area? Of the 296 licensed psychologists that answered question 2, the vast majority, 86%, reported living in or practicing in an urban area, followed by individuals that were practicing in a rural area. And then I referenced there, according to the census, about 57% of individuals in Kansas report living in urban areas. So there is a little bit of a difference between practicing in an area versus living in an area. But it was interesting to see that such a high level of practice is being done in urban areas, but it was up to 86%. I think if you were to look at the other reports for the other professions, that number is a bit lower, as there is a bit more concentration of practitioners split between urban and rural areas. There's still usually about 2/3 in urban compared to rural, but the 86% compared to 14% may be the highest split that I have seen between the professions. Question 3, do you primarily work in public practice, private practice, educational setting, or another setting? Of the 297 psychologists who answered question 3, over half, about 55%, noted working in private practice. And then that was followed by about a quarter, or 23%, who noted working in public practice. And then there were also about 12% of individuals who selected the other category, and then about 10% in education. And for education, that is pretty consistent across the professions, usually about 10 to 15% in education. But those are the numbers for psychologists. And question 4, how many years have you practiced the psychology profession? If applicable, you may include years practicing psychology in other states. So again, we had 297 individuals, psychologists, who answered question 4. When they were asked how many years they've been practicing, this is actually just psychology in general. The most common response was over 10 years, and that was about 81% of individuals who responded to the survey. And so by far, the largest category was individuals who've been practicing psychology for over 10 years. And then the next most common number was 5 to 10 years at about 11%. And then every other total, 2 to 5 years, 1 to 2 year, and less than a year, any of those categories were less than 6%. So, so a lot of individuals practicing in Kansas have been doing so for over 10 years.
Dave, I have a question about that. I'm sorry, if you want for questions to be held at the end, I can take my question later.
No, that's okay. Go ahead and you have a question?
So does that split in the years practice, is that similar across professions, or are we as psychologists different in some way than other fields?
I think this may be one of the highest totals that I've seen in terms of the over 10 years. So I think a much more pronounced split. Some of the other professions, and some of the professions that have tiered licensure, we tended to break out the questions and ask all of the, let's say, licensed professional counselors. And then we had a separate way of tracking the information for the clinical professional counselors. But even for the independent practitioners in some of those fields, it wasn't as pronounced as this is for psychology. I think you see more of an easy slope versus such a high number of individuals for the over 10 years.
Thank you.
For question 5, including Kansas, and how many states are you licensed as a psychologist? We had 295 individuals who answered that question. The majority, but it was just a slight majority of all respondents, noted they were licensed in one state, and that was about 54%. There was a high number of individuals that are licensed in 2 states, about 34%. And then the numbers are much smaller for the other categories. 3 to 5 states was only about 8.5%. And then we didn't have anyone in the 6 to 10 category, but we did have at least one respondent who marked over 10 states in which they are licensed. And then one, I guess that was more than one person who noted that. So at least 2 practitioners responded they are licensed in over 10 states. But you know, I think that number is probably smaller in terms of only being licensed in one state compared to some of the other professions. I think some of the other professions, they tend to be licensed in just Kansas, whereas in psychologists, that licensing in 2 states was probably higher than what I've seen for most other professions. In question 6, do you maintain an active license but no longer work as a psychologist? If so, please explain why you are not providing services currently. And one of the reasons we asked this question, so as we have been looking at workforce and having discussions with other groups, we hear frequently people come in front of legislative committees, for example, who say everyone is leaving Kansas, and there's there's concerns, and there are workforce concerns, and there are issues in terms of needing more providers. But in the last 10 years, our overall licensee totals have increased from about 12,000 licensees to over 16,000. So we know there's more people getting licensed. We know there's more people out there that could be providing services, but there's also been a shift. And for some of the professions, we have seen individuals moving from, let's say, a bachelor's level social work license to a master's level social work license, as more people are staying in school and getting a higher level degree, and even a shift between, let's say, master's level social work and clinical social work. But as individuals are getting more advanced degrees or becoming independent practitioners and reaching the highest level of their profession, that also makes those individuals more attractive to industries outside of the profession that may want those individuals to come in and, let's say, be a leader or work as an administrative head of some of those entities. And so for me, for example, I am an attorney. I keep my law license active, but I don't go in front of a judge. I don't do estate planning. So if you were to ask, you know, are you practicing as an attorney? I'm not, but I am still an attorney. My license is active. So it should be counted. But we wanted to get an example here on this question to find out, you know, can we get at least a snapshot, or can we better understand what percent of individuals may be holding on to a license but not using it, and why that might be occurring? And so 173 individual psychologists answered that question. The most frequent response of the 173, which was from 140 people, they noted that they were continuing to provide services and work as a psychologist. So the vast majority of people that did hold an active license are still providing services. But there were 20 respondents that were not providing services despite maintaining an active license. And the most common reason for this response, which was from 13 individuals, included being in a position that did not require a license for job responsibilities. And other respondents noted maintaining an active license was required to hold the position, but unrelated to the task required for the job. And then 4 respondents indicated they were actively retired, though their licenses had not yet expired. I think other individuals that could potentially fall into that category might be individuals that are between jobs, where you want to make sure that you retain your license, that you are still eligible to seek new positions. So if there are individuals that might fall in that category, that could be an example as well. But at least the vast majority of individuals that we saw in this category were still providing services with an active license.
May I ask a quick question?
Yes, go ahead.
Can you tell at what point people let their license lapse after licensure in terms of years of licensed practice?
That is not something that we included in the survey, but that is something that we could collect some information on.
I'd be curious if that's connected to that jump. Like if people are getting licensed prior to within 5 years, and then they're leaving the state. So our providers are made of people under 5 years and people over 10 years.
Okay. One thing that I can look into, so psychologists are a little bit different than the other professions in that you all renew by June of even numbered years.
Right.
So when that crosses, we have a pretty good list of individuals that have let their license expire between those 2 months. And so we can do some analysis on the list of individuals whose licenses did expire, and then see what percentage of those individuals have been long-term practitioners, which ones short-term practitioners. We were thinking about studying that at some point, looking to see with some of the other professions, when your license expires, is it because you are retiring? Is it because you have, burnout and you are a relatively young practitioner, but you're going to be doing something else? And so that's one thing we haven't studied. It's not part of this survey, but we can collect some information on that.
Yeah, just curious. Thank you.
Sure. Question number 7. In a typical week, how many hours do you provide in-person services to clients? And so on this, the 296 psychologists answered question 7. Most popular response was between 20 to 40 hours, as might be expected, but it was only about 40% or 39% who responded with that total. The next most common was between 10 to 20 hours. And it should be noted here, we didn't define this term in terms of in-person services. So if someone is saying that is just time between when I'm in front of a client, and it's not including my paperwork or other things that are part of my job responsibilities, that may be how people defined it. We don't know because we didn't really define this term for them. We left it open and kind of broad. But in terms of how individuals may have answered that question and defined that term, the two most common ones making up about, let's say 60% or a little bit over were either between 20 to 40 hours per week or between 10 to 20 hours per week. But it was notable that about 22% said that they were providing less than 5 hours of in-person services per week. Now, about half of that may be accounted for because of education, perhaps. There are about maybe 10% of individuals who responded who noted they work in education, so maybe they're looking at that differently. There were other individuals, at least in some professions, who said they spend time providing supervision, but not direct services to clients at this point. So it could include some of those individuals, but these totals were kind of interesting.
What about psychological testing then? If you, would that be included in in-person services? I guess direct time with the person, but then afterwards you would have to score, interpret, and write up the report. I'm assuming that part would not be part of the in-person services, or am I wrong there?
Well, since we didn't define the term, I guess it would be up for the psychologist to make that determination themselves. I could see some individuals saying it is still related to the clients that I saw in person, so it could be related to that. But I could see others who might say, I'm only counting the time that I'm directly in front of a person, not the time that I'm doing stuff when they're not there. So unsure, but I could see that being maybe an area where people were saying, I'm not spending direct time in front of individuals, but I'm spending part of my day doing some of the testing or other things like that.
Thanks. Thank you.
One way we differentiated question 7 from a couple of the following questions is we asked individuals first, how many hours do you provide in-person services? Followed by, in a typical week, how many hours do you provide telehealth or remote services to clients? And we had almost 300 psychologists who answered that question. The most common response was less than 5 hours, about 57%, which was a bit higher than some of the other professions, but not the highest. I think there were some that there's just some professions don't provide a lot of telehealth or remote services, but it was notable. It was interesting to me. And then about 19% responded about 5 to 10 hours per week. And then about 17% of respondents that do about 10 to 20 hours of remote services per week. And then 20 to 40, about 6.7%. Question 9, we asked in a typical week, how many hours are you responsible for supervising, managing, or overseeing the work of others? We had 293 psychologists who answered this question. The most common answer, about 2/3 of respondents said that in a typical week, supervising the work of others, managing or overseeing the work of others, it was less than 5 hours. And then the most common response after that was about 15%, which was between 5 to 10 hours per week. And then 8.2% for 20 to 40 hours. And then every other category was about less than 6% after that. Question 10, we asked, do you anticipate retiring from the psychology profession in the next 5 years? And this was a question that we asked, I think, all the professions to kind of get some comparative information. And the most common answer of the 296 psychologists who answered the question was no, with a little over two-thirds of respondents, about 69%. But the next most common answer was yes, with about 18%. And then the category that was unsure was about 13%. Now, if the category that is unsure actually does end up retiring in the next 5 years, that might mean if you combine the unsure with the yes, that would be roughly 30% that could be retiring in the next 5 years, which is interesting. I think, for most professions, the no answer was also the highest total, but it was usually a little bit higher than the 69% that you see here.
How does that compare to how many LPs get licensed every year in the next 5 years? Will we maintain the same number with that, or by 2030 will we be below if we don't have higher numbers?
It's interesting. Psychologists are licensed over, continuously over the course of 2-year period. And then when that renewal hits, then you see a dip every couple of years as all the expired licenses hit at once. Compared to the other professions, I think this total is the number of people that are saying they expect to retire or are unsure. That total appears to be higher. And so if individuals do end up retiring compared to the amount that are becoming licensed as licensed psychologists currently, I think we can expect to see the total number of psychologists probably decrease. It might also be impacted by SIPAC, and if there's more people that are choosing to let their licenses lapse. There may be individuals who are dipping their toe into SIPAC, but as the years progress, there might be more and more people doing that from out of state. So you might see individuals, I think with that question that asked about how many states are you currently licensed in, I think it was 57% for one state, but a good solid, I think maybe over 30% that were licensed in 2 states. And I think over the next few years, you'll probably see a shift in that number between a lot of states, where a lot of psychologists, I would imagine, as long as their surrounding states are joining SIPAC, I would guess you'll probably see a dip and closer to more people becoming licensed in one state than multiple states. Question 11. So this was a question that we asked about the advisory committee. We noted that to assist the work of the board, the BSRB has 7 standing advisory committees, one for each of the professions, which are primarily composed of licensees in each of the 7 professions. Advisory committees discuss topics relevant to the work of the board and make recommendations back to the board on potential changes to the statutes and regulations governing the profession. These meetings are broadcast on the BSRB YouTube channel every other month. On a scale of 1 to 5, how familiar are you with the work of the Licensed Psychology Advisory Committee? The most common answer, with 64%, was that they are not familiar with the advisory committee. The next most common answer was about 22%, and that they were somewhat familiar. And then the other answers for completely familiar, very familiar, and average were all under about 7%. Now, I can tell you that is pretty common, as you will see similar results across the other professions. However, what we did see in some of the open field responses that followed this was a thank you for us notifying licensees about the work of the advisory committees. And while they said they are not familiar with the work of it, they also were not aware that these meetings are so accessible and that they're being broadcast on YouTube and the materials are available. And some of them said, I'm not aware of the advisory committee, but I didn't know that it was out there on YouTube, and I'll make more of an effort to become aware of the work the group is doing. So I think by us just including that question on the survey, I think we'll see a positive response and more people following the work of the board and taking advantage of the resources that are being made available. Question 12. Over the past 2 years, based on your observations and experience practicing in the psychology profession, could you share information on any practice-related negative issues you have seen, such as areas where practitioners appeared to need more continuing education or training in a certain area? And so 223 psychologists answered that question, and they identified a wide variety of comments. The comments in full can be found in Appendix 3 on page 18, but we summarized that information here. 41% of respondents, or 41 actual respondents, indicated having experienced no practice-related negative issues in the past 2 years. So we do want to highlight that there were some individuals who said, no, don't believe I've seen practice-related issues, because that is positive. However, 11 individuals responded that it centered on diversity training and continuing education hours. Specifically, the most frequently reported training needs are in the following categories: insurance, diagnostic, ASD and neurodivergent, trauma, evidence-based treatment, ethics, AI, and suicide prevention. While less frequently identified than the previous noted items, other licensees pointed out other practice-related negative issues concerning legal services. Other respondents indicated seeing concerns in the areas of trauma, master's level psychology practitioner, and boundaries, testing, mandatory reporting, and care for youth. Concerns were also raised regarding licensed psychologists supervising other professions.
Oh, I have a question regarding that. The first item that was listed as insurance do you have more information about what it is meant by insurance? Is it like, do people need more information as to how to file an insurance claim, or is it that people think that there are issues with insurance kind of writ large generally? Do you have any more information about that in particular?
I don't recall the specific issues that were noted, but if on page 18, we have all of the specific answers that people gave. And my thinking would probably be, that at least in some of the professions, I've seen a few different versions of this report, so I can't say for sure that these are coming from your report or from others. But one of the items that I did notice from different groups is they said, some said we would prefer that there be more advocacy for insurance reimbursements for the profession, or some of the groups did say, in terms of billing, that people could use some additional training in terms of how that process works. So I would guess that probably some of the comments fell in one of those two categories on insurance.
And my second question is, when it comes to the themes that were revealed here, are there similar themes that were found in across the other professions under the BSRB umbrella?
I would say in general, there are a lot of common areas. Some of the respondents in other professions, with their lack of familiarity about the work of the advisory committee and perhaps the board, so some of the concerns where they would like the board to advocate more for the profession, which is a little outside of the scope of what we do. We're not an advocacy organization. The board is primarily here to protect the public. However, as we work to be good partners to address the current issues the state is facing, like workforce and things like that, we realize that we want to be knowledgeable about how some of these things work, and the board may take a position where they're not opposed to something, but it may not be something that would fall under us for the licensing board to advocate for. So I've seen a little bit more of that outside of the psychology profession, but for some of these responses, they were a bit more focused on the specific topic. I did notice a common trend as far as AI and also ethics, and we'll see that a little bit more as we go through some more questions. Question 13, over the past 2 years, have you experienced any issues concerning telehealth, either through professional practice or observations of other practitioners? 236 psychologists answered that question, identifying a wide variety of comments on telehealth, which can be found on Appendix 4 on page 29. A summary of that is that 142 responses indicated having no issues concerning telehealth. Some respondents mentioned that telehealth has improved the accessibility of services. There were some other positive remarks about telehealth. Both positive and negative remarks were identified in responses to the survey question. Among the positive remarks, the most frequent occurring statements were as followed. Telehealth is easy. Telehealth requires less paperwork than in-person services. Telehealth benefits rural outreach. Telehealth is helpful when transportation issues arrive, and telehealth works well with adults. The following negative remarks about telehealth are the most frequently reported. There are additional insurance barriers to face if providing telehealth. Clients and providers are not in an appropriate or secure location during the session. Some connectivity and internet issues occur at times with telehealth. There's an ability to get to know the client and patient safety after sessions, which can be impacted, and also handling state regulations across state lines. Question 14, we asked how many individuals you currently provide supervision to. Unfortunately, there was one item we missed when we were drafting this question, and that is to give people the opportunity to say they provide supervision to 0 individuals. So if you're wondering why the prefer not to answer comment is so high, that is because a lot of those individuals would have probably picked the 0, and they told us as much in the comment section for other questions. But for the individuals that did provide supervision, the most common was that they are providing supervision to 1 person with 23%. The most common after that was about either 2 or between 3 to 5, with about 15% of both of those answers. About 6.4% provide supervision between 6 to 10 people, and then about 4.8% provide supervision to more than 10 individuals. Question 15, we said over the last 2 years, have you experienced any negative issues involving supervision? If so, please explain. 235 psychologists answered that question. 24 respondents indicated no negative issues involving supervision. 83 respondents said they do not currently provide supervision. However, some respondents reported experiencing negative issues. The negative issue that was reported more than once was the recurrence of supervisees not being at the same standard post-graduation as previous groups. Other negative comments highlighted the issues of generational differences, high levels of burnout, and allowing psychologists to supervise other professions.
So I have a question about that, the very last piece. So psychologists were reporting that it is an issue for psychologists to be supervising, say, an LMFT or whatever. Is that the crux of that answer?
And I'd probably have to go back and look on page 36 to get that answer. And it may have just been 1 or 2 who indicated something like that, because that was one of the least frequent comments, but I don't know exactly what was said on that one.
Randomly, I was just reading those, and I only saw, there was probably more than one, but I saw one person who was talking about how they wanted to be able to supervise LPCs, saying that the overlap between psychology and licensed professional counselors should allow psychologists to supervise an LPC.
Okay.
I just randomly was reading that.
Thank you for referencing that. I believe we could word that a little bit more effectively when we do the final version of this, because that is a very good distinction, that one of the issues is that there is not the level of flexibility that people would like in terms of being able to provide supervision to other professions. So, question 16, do you currently use artificial intelligence in your practice? If you do, in what areas do you use AI? 257 psychologists answered the question. The vast majority, 196, responded that they do not use AI in their practice, and 11 expressed they'll be moving towards using AI, and 3 were unsure. For the licensees who indicated using AI in their practice, the most frequently reported use of AI in practice was for writing and grammar. Less frequently reported uses included documentation, treatment planning, marketing, and research. And I think when we have the final versions of the report, what we will try to do is have a bulleted list on this so that if individual respondents mention specific AI technology, we can highlight that. We can have a pretty good list at the end when we're talking about AI. And I think we have about maybe 2 or 3 questions left. I guess 2 questions left. Question 17, based on your experience with the licensing in Kansas, do you have any recommendations on additional ways the BSRB could protect and serve consumers of services offered by BSRB licensing? 297 psychologists answered the question. 92 psychologists reported having no recommendations or additional ways the BSRB could protect and serve consumers of services. So I do want to take a moment to just kind of highlight that. You know, when you open up and you ask a question like this, you can receive any kind of responses from individuals. And to have 92 that said, you know, can we do anything better to protect and serve citizens of Kansas? And they said no, I think that's worth noting. So I do take that as a positive comment. 12 responses did center on insurance and reimbursement. Specifically, the most frequently reported responses are in the following areas: telehealth, evidence-based practice, complaints, master's level psychology, supervision of other professions, children and families, and the need for free continuing education hours. While less frequently identified than the previous items that were noted, other licensees pointed out other issues such as social media, SIPAC, ethics, and burnout. Other respondents indicated the EPPP and post or pre-doc hours, and concerns were also raised regarding the terms psychologist and vulnerable populations. And then the last question on the survey, do you have any other comments or feedback you think would be helpful for the members of the advisory committee to receive when evaluating possible recommendations for changes to the statutes and regulations for the profession? This was our catch-all question that if nothing really went towards a concern they wanted to notify us about, or if they had things that were not specifically referenced, they could tell us about this question. 180 psychologists answered the question, and 91 respondents stated they had no recommendation. The most frequently reported topics in response to this question included things like telehealth, insurance, master's level psychology, and protecting the title of a psychologist. Other respondents noted medications and prescriptions, artificial intelligence, and allowing psychologists to supervise other professions. And so this report in and of itself is about 60 pages, but we've only gone through the first 12. This has been an effort to make sure that we're putting in the most important summary information first. But like I said, we wanted to make sure that we preserve the voice of individuals as much as possible. So in the pages that follow, we have probably right around 15 or so appendices with information for some of the catch-all questions or some of the open field questions, so that individuals could provide us a lot of responses. And so, and individuals did. On some of these, when we have almost 300 people respond to a question, it's a lot of information, it's a lot of data to review. And so what I would encourage the members of the advisory committee to do between this meeting and the next one is to go through some of these appendices and read through all the comments from the individuals who filled out the survey. We don't have time to go through them all in the meeting itself, but I think that, we have tried to summarize information and we'll still work to kind of make that a bit clearer, but there's so much context here and people were so generous with their contributions in terms of providing us with information that I think, it's great to have such feedback and such a snapshot into the thoughts of all the practitioners. And so I'm really excited about this. And this is, I'm spending time with all of you tonight, and I really appreciate working with your advisory committee. But we have this for 6 different professions. And so I'm really excited to take all of this and combine it with the other professions. And so the board can see all this feedback and all this information from so many licensed professionals. So I'm excited about it, but I'll go ahead and stop sharing now and just see if you all have any comments or questions having gone through this draft report.
Any questions?
I don't have a question, but I will say, as I was reading through these, it's really interesting how much of this is applicable to our other conversation about practicum experiences. The number of these comments that are connected to people being less prepared, poor student performance, particularly in the supervision question. It's interesting because these are obviously all supervisors. And if we're talking about the number of hours we want people to have coming in, when supervisors are already consistently reporting it's triple the work that it used to be, that should probably be taken into consideration. Just, yeah, there's a lot of comments here.
I find it interesting that in the report, from the questions that you review with us, there were concerns raised by psychologists about LMLPs and the rate at which this kept coming up. And I'm just wondering about the flavor of those responses. And I know that they're listed, or a number of those responses are listed in the appendices, but Dave, do you have a recollection of the type of concerns that were raised about LMLPs?
Profession-wide in general, I think there were some comments as far as making sure that people understood the distinction between people practicing with a master's degree versus a PhD, and the difference in experience and education and training. I think there was also, if I recall correctly, I think there were some concerns related to the testing that was done by master's level practitioners compared to PhD level practitioners.
Yes.
So I think those two things off the top of my mind. If there were more specific ones, I'm not sure, but those are the ones that kind of come out to me right away. So.
The only other thing I saw more than once, both of those things, and there was some things in here about how LMLP programs have become stepping stones to doctoral programs. So they feel like their LMLP students are less qualified because so many of them move on. I don't know that I agree with that, but that is the other thing I saw in here.
I have found over the years that people just do not understand the difference clearly between like a PhD clinical psychologist or a master's level or bachelor's level or counselor. What is a counselor? Social work. There's just it's very sad to me to just see that I have to educate people all the time that there are differences in the professions and what they know and the level of training. And this seems to be an ongoing issue with MDs or DOs. It's a different situation. But in our field, you could be a counselor, go out saying that you, with a bachelor's degree even, and set up a shop as a counselor. So, even though you're not licensed, there's just a tremendous amount of disparity in our field like that. And I wish there was a simpler way to educate the public about the levels of training. I really do. I just want to share that thought. I don't know how to do it, but that's been an ongoing thing that's bothered me all these years of practice.
Yeah, it is tricky with master's level psychology when you're talking about different states, because currently I think 17 states license master's level psychology, but the terminology that's used state to state is dramatically different. And we are unique in that we have two levels of licensure for master's level psychology, including the independent level. But our term licensed clinical psychotherapist is not a term that is comparable or recognizable in other states, because it's just a profession that there's a lack of uniformity in terms of what practitioners are able to do state to state, what it's being called state to state. There are some efforts to help with that. I think both the APA and also ASPPB had committees or task force that were looking at master's level psychology. I've seen those discussions and I've seen what they put forward. And as you might imagine, there's not a lot of consensus necessarily yet. I think part of it is I think they're trying to provide a model that would be something that the states who don't license would be interested in adopting if they were going to move towards licensure. But for the BSRB, we've been licensing master's level psychology for many, many years. We're just unique in a number of different ways, and that profession has been in existence, I believe, since about 1987. So I think we've had master's level psychology for a very long time in one form or another. So it is difficult.
And to that end, I think that we might be the only state, if I remember from what was said at ASPPB, maybe there was another one, but I think that we're the only state that provides licensure for master's level psychologists at 2 levels. We may be just 1 or 2 in the country.
Yeah, and you know what's interesting about that is when I'm reading through these comments, every one of them except one refers to them as LMLPs. So it makes me curious if they know there is a higher independent licensure that comes after near 2 years of supervised experience with an LP. It has to be an LP. Well, mostly has to be an LP. So I'm curious about that.
Yeah, and it's interesting when we have the other professions with tiered licensure, if you achieve a license at a higher level, based on, education, meeting the criteria of extra hours or passing a certain test, your previous license becomes obsolete as you move from one license level to the others, with the exception of master's level psychology. And as I understand it, that was an arrangement that was made because the master's level psychology lower level license includes the term psychologist, whereas the licensed clinical psychotherapist doesn't necessarily have the term psychology in it. And so it's possible that if you only had a LCP, other states may not recognize that as much as they might recognize a level of license that had the word psychology in it. And so as I understand it, there was efforts that were made that would allow people to keep both an LMLP and an LCP license active if they chose to do that. So I think part of that was meant to address some of those issues, but it definitely is a unique profession concerning some of those topics.
Something else that, at least from what was presented today, that I noticed is that some of the issues or concerns, or maybe even a fair number of the issues or concerns that were discussed by participants are better directed towards the guilds. So better directed towards KPA, the Kansas Psychological Association. Like the KPA would be better equipped to answer the questions or assist with the concerns that were listed. So like going back to insurance, like you said, that's not something that the BSRB would address. However, that is something that KPA could address in their advocacy work, because like you said, we're not an advocacy organization. We are an organization to protect the public trust.
But one of the nice things about, there's sort of been a call for this information or a need for this information as we've been in different committees, and people have been making some anecdotal comments based upon a small sample size of people that they may know directly. But I think this information was necessary. And so some of this could drive the work of the board, the advisory committee. Some of this might work in terms of us sharing this information with the association, or starting conversations with groups in which we may have not talked in the past. Like I was thinking, it would be neat to kind of set up a little meeting with maybe representatives of the Department of Labor or different groups so that we haven't really talked to, but they might find this information very helpful for some of the work that they're doing. And so my hope is that we can have this as a nice tool for the advisory committees and the board to use, but also that we can share this with other agencies around the state, other partners like the association, and then outside the state with some of those national associations too. I'm really excited about what we have here and what it's going to look like at the end when it's all cleaned up and nice.
Something I would be interested in is there's a lot of talk about LMLPs and concerns within some of these comments. In the social work survey and any of the other, I'd like to know what they think of us and what maybe blind spots they're thinking that we have. I think that would be helpful to know what
Well,
they think are.
Yeah, that's a good question. We did not survey social workers this time around, but we do have a survey report posted from their professions that asks some similar questions, and that is posted on the BSRB website under resources and publications. So there's I think, a posted report from a survey from 24 and also one from 21. And we are somewhat amateurs as we are getting better and learning how to do these types of reports. But I think there's some good information that might be helpful in those ways.
Anyone else have any comments or any thoughts that they would like to share regarding the report as it is in draft form? Well, Dave, again, I want to thank you and the folks in the BSRB office for your time and your dedication to putting this all together. I know that it is not a simple undertaking. And if I might speak for the advisory committee, we really appreciate the work that has been put into this endeavor, and we look forward to seeing the final report and looking at also how other professions how they've answered these questions and what we might, as you were saying, what we might be able to do to share this information to stakeholders across the state and beyond.
Thank you, Richard. I appreciate the comments, and I'll share that with members of my staff as well.
So we are at 7:55, and there are a few different items on the agenda that remain. There's the town hall, the discussion about the town hall, a discussion about recruitment to the advisory committee. We do have folks that are rolling off of the committee, and also potentially discussing the APA draft of the ethical principles for the code of ethics. And with there just being a few minutes left, I'm reluctant to start down any of these because they are, I think that there can be significant discussion about any of them. Dave, do you have any thoughts as to what we might do, or should we just take an early adjournment, let folks go 4 minutes early?
I don't want to be the last person who's always asking questions before the end of the class, but I think there's one topic we can handle real briefly, and that is item C, advisory committee recruitment.
That's fair.
We have, based on the advisory committee and how it is organized, we have the 2 psychologists on the board and a public member, and then the other individuals that serve on the advisory committee, we can have between 3 and 10 non-board members, and those tend to be licensees in the profession, practicing in different areas usually. And of the current members of the advisory committee, we currently have 10 members on the advisory committee, but 2 of those individuals are reaching their 4th term. So they would be having to come off the advisory committee at the end of June. And that is Abby Callis and Doug Wright. And so we really appreciate the work that they have done on the advisory committee, and really appreciate both of them. But since they will need to come off the advisory committee at the end of June, that does open up 2 spots. Traditionally, what we have done is we have sent out a message to all licensees and said, if you would like to serve on the advisory committee, please provide a letter of interest and a copy of your resume or CV. And then we provide those to the advisory committee members. You review those, have a discussion at a future meeting, and make recommendations back. Ultimately, it's the chair of the board who has the authority to appoint to the advisory committee, but you can forward your recommendations to the chair. So if you'd like me to go ahead and do that again, I'm happy to send that out between now and your next meeting. So that way those members can be appointed and begin to serve at the beginning of the next current fiscal year.
I think that would be appropriate, more than appropriate. I do want to remind members that we have a truncated period of time between this meeting and the next one because this meeting was postponed. So our next meeting, just for everyone's awareness, would be the second Tuesday in June, and that is June 10, 2025.
And I have one last note about advisory committee membership. Officially, advisory committee members serve 2-year terms, and you can be reappointed up to 4 terms before you would need to come off the advisory committee. We're trying to do a pretty good job of keeping track of the end of those 2-year terms. So there are a number of current members of the advisory committee, about 7 actually, who are reaching the end of a 2-year term. So my assistant, Emma, is going to be reaching out to all of you by email to see if you're still interested in serving and would like to be reappointed to a second or another term on the advisory committee. And if you are, just respond back to her, note that, and then those lists of names will be provided to Richard and also the chair of the board. And then officially members would be reappointed at a future board meeting. So be on the lookout for that email from Emma.
Thank you, much appreciated. So we have landed at 8 p.m. on the nose and seeing, well, first, are there any questions or any discussion about anything that we have discussed? Seeing none, I will take a motion to adjourn this meeting.
I motion to adjourn the meeting.
Mark motions. Do we have a second?
I can second it.
Multiple seconds. And I don't think that we necessarily need to vote on that. You all have a good rest of your Tuesday evening. And again, our next meeting is Tuesday, the 10th of June, 2025 at 6 p.m.
Thank you.
Thanks,
Thank you.
everyone.
Thank you very much.